Now, and welcome all to meeting number 9 of the House of Commons Standing Committee on Indigenous and Northern Affairs. I'd like to start by acknowledging that I am joining you today from the traditional territory of the Haudenosaunee, the Anishinaabe, and Chinantan nations. Pursuant to the order of reference of April 20th, 2020, the committee is meeting for the purpose of receiving evidence concerning matters related to the government's response to the COVID-19 pandemic. Today's meeting is taking place by video conference, and the proceedings will be made available via the House of Commons website. During this meeting, the webcast will always show the person speaking rather than the entirety of the committee. In order to facilitate the work of our interpreters and ensure an orderly meeting, I'd like to outline the following rules. Interpretation in this video conference will work very much like in a regular committee meeting. You have the choice at the bottom of your screen of either floor, English, or French. In order to resolve the sound issues raised in recent virtual committee meetings and ensure clear audio transmission, we ask those who wish to speak during the meetings to set your interpretation language as follows. If speaking in English, please ensure that you are on the English channel. If speaking in French, please ensure that you are on the French channel. As you are speaking, if you plan to alternate from one language to the other, you'll need to also switch the interpretation channel so that it aligns with the language you are speaking. You may want to allow for a short pause when switching languages. Before speaking, please wait until I recognize you by name. When you are ready to speak, you can either click on the microphone icon to activate your mic, or you can hold down the space bar while you are speaking. When you release the bar, your mic will mute itself, just like a walkie-talkie. A reminder that all comments by members and witnesses should be addressed through the chair. Should members need to request the floor outside of their designated time for questions, they should activate their microphone and state that they have a point of order. If a member wishes to intervene on a point of order that has been raised by another member, they should use the raise hand function. This will signal to the chair your interest to speak. In order to do so, click on Participants at the bottom of the screen. When the list pops up, you will see next to your name that you can click Raise Hand, and I will try to be very attentive to that today. When speaking, please speak slowly and clearly. When you are not speaking, your mic should be on mute. The use of headsets is strongly encouraged. If you have earbuds with a microphone, please hold the microphone near your mouth when you are speaking to boost the sound quality for our interpreters. Should any technical challenges arise, for example, in relation to interpretation, or if you are accidentally disconnected, please advise the chair or clerk immediately, and the technical team will work to resolve them. Please note that we may need to suspend during these times, as we need to ensure all members are able to participate fully. Before we get started, can everyone click on their screen in the top right-hand corner and ensure they are on gallery view? With this view, you should be able to see all the participants in a grid view. It will ensure that all video participants can see one another. During this meeting, we will follow the same rules that usually apply to opening statements and the rounds for questioning of witnesses during our regular meetings. Each witness will have up to 5 minutes for an opening statement, followed by the usual rounds of questions from members. And so now it's time to welcome our witnesses. From the missing and murdered Indigenous women, girls, and Two-Spirit people, the Manitoba Coalition, Hilda Anderson-Pearce and Sandra DeLaronde. From the Native Women's Association of Canada, Lorraine Whitman, and actually we're still waiting for Miss Whitman, and from the Women of the Métis Nation, Melanie Omaniho. And so we'll begin with 5 minutes of witness testimony, starting with Hilda Anderson-Pearce and Sandra DeLaronde. Please go ahead for your opening statement.
Thank you for the opportunity to present to this standing committee. I wish to acknowledge the land and the people of Treaty 1 and Treaty 5 territory and the homeland of the Métis Nation. My name is Hilda Anderson Piers, and I'm the co-chair of the MMIWG Manitoba Coalition. The MMIWG Manitoba Coalition is comprised of diverse Indigenous representation from nonprofit women and family serving organizations, Indigenous governments, individuals, MMIWGS, 2S+, and family members and survivors. I am here because you really need to understand us as Indigenous people and how COVID-19 is impacting Indigenous communities and organizations. Canada, you need to respect the sovereignty of nations and allow for the autonomy to make our own decisions. We need you settlers to listen, not because it is a nice thing to do, but because it is the lawful thing to do. What the pandemic is doing is exasperating the inequalities that we already knew were there. We are seeing violence, we are seeing discrimination, and now we are seeing more violence. And we are faced with challenges about how we provide frontline supports for people because of the physical distancing and the lack of adequate resources. The pandemic is exaggerating our crisis. We knew the healthcare systems in First Nation communities were poor before, and now we are seeing truly what a breaking point they are at when it comes to supporting survivors of violence and those impacted by the pandemic. We are living the impact of short-term project-specific funding, which is detrimental to Indigenous communities and organizations. Stable long-term funding is critical to having the capacity and the ability to pivot quickly into something like a pandemic. The communities know best where they need to pivot to meet the needs of that moment. What the pandemic is showing us is that we need to be nimble. You cannot simply ask Indigenous communities and organizations to pivot all their funding to the COVID-19 pandemic because the disparity Indigenous communities and organizations were dealing with before the pandemic is still there. And in some areas, there is even a greater need. Yes, we need COVID funding, and Indigenous people still need the funding that was inadequate before the pandemic. Yes, we need the anti-violence funding. We now need that more than ever, and we need specific resources to respond to the COVID context. Additionally, we have seen that there has been an increase in the number of gender and human rights violations, such as the lack of access to food security, shelter, and medical care. We do not have the adequate resources to address and support victims of violence. If supports are not readily available, we will continue to die and experience alarming rates of violence. It is time for this government to fully implement the 231 calls for justice. We cannot wait any longer. Our lives are sacred. Thank you.
Good afternoon, Mr. Chair. My name is Sandra Delaronde, and I'm also co-chair of the Manitoba Coalition. And we thank the Standing Committee for the opportunity to present today. We acknowledge this government and provincial territorial governments for finally establishing a national inquiry in 2016 after more than 20 years of advocacy by families, survivors, and Indigenous women's organization, though we are concerned about the lack of inclusion in creating a national strategy to end the violence. This pandemic is highlighting the desperate and impossible situation our women and girls and 2S LGBTQIA find themselves in. Imagine the terror of being locked in with your abuser for weeks and now months. We have 3 requests for this committee. The first one is Winnipeg is the only city without a low barrier safe space for women and girls to protect them from staggering rates of violence and by intimate partners and through trafficking. And 2, that along with the violence walks homelessness, particularly for Indigenous women who are fleeing. The lack of decent housing in the city and on reserve means that multiple generations of families live in a single family home. In some communities, the count ranges to up to 30 people in a 2-bedroom home. This chronic underfunding and profoundly inadequate circumstance existed long before COVID-19. But the pandemic is more deadly because women have no housing options and nowhere to go. Of the 634 First Nations in Canada, only 46 funded women's shelters. Only 4 shelters exist in Manitoba First Nations. The final quick point I'd like to make is on mental health and well-being. the long-term effects need to be addressed now and for the long term. As a coalition, we'd like to thank Leah Gazan, MP for Winnipeg Centre, for her efforts in supporting our community to ensure the well-being of Indigenous women and indeed all women who are at risk for violence. We look forward to working with this government to end violence and make this country one where every human being is safe, because we deserve nothing less. And we remember those many women, mothers, daughters, sisters that have gone missing or murdered because of a lack of action. Miigwech.
Thank you very much. I see that we're joined by Ms. Whitman now, and I'm going to ask the clerk if we have a good sound check for Ms. Whitman.
Good day, Ms. Whitman. If you could maybe introduce yourself for about 15 seconds, and then we'll proceed to taking your statement.
Louise Lorraine Whitman, grandmother white sea turtle and president of Native Women Association of Canada.
Interpretation, do we have good sound?
Thank you.
Okay.
I've been told maybe speak closer to the microphone, hold it closer and more stably towards your mouth. But other than that, we should be good to go for your opening statement. Thank you.
Ms. Whitman, if you're ready to go, you have 5 minutes. You're next on the order paper. So please go ahead and welcome.
Thank you. Good afternoon. My name is Lorraine Whitman, grandmother white sea turtle and president of Native Women Association of Canada. I am also here, we defend and represent the rights of First Nation, Métis, and Inuit women across Canada and internationally. You have asked me here today to talk to you about the ways in which COVID-19 pandemic is affecting Indigenous women, and I appreciate the opportunity to be able to share in WAC's finding and also our concerns. We have been working on our horrific problem of the missing and murdered Indigenous women, girls, and gender diverse people for decades. And we are the organization whose calls for action led to the inquiry that submitted its final report and recommendations in June of last year. I am here today to talk about the pandemic, but I am also here to talk about the violence in our communities, and these two issues are fundamentally linked. Canadians across the country are fearful about the health effects that the disease is having on their loved ones and the financial and social toll it is taking upon themselves and their communities. For Indigenous women, those fears are amplified many times over. I don't need to tell you that before COVID-19 hits our shores, Indigenous women and their children were amongst the most vulnerable population in Canada. But I am going to say it anyways. We are vulnerable. We need help, and we are worried that with all of the other problems being created by this disease, we will be overlooked by governments that promised us of them to help make months ago that we were abandoned, and that many of us will die as a result of this virus, and as a result, its incubation in the social poverty in which many Indigenous women now live. As the pandemic threat grew, NWAC conducted a needs assessment with its provincial and territorial member associations, but two via phone had resulted paint a frightening picture. The federal government's own statistics show the spousal abuse of Indigenous women is more than 3 times higher than that of non-Indigenous women. Imagine being forced during a pandemic to self-isolate in a small house on a reserve with many family members and a spouse who is already prone to being abusive, a spouse who has no longer his usual outlets of letting off steam. The statistics also say that before the pandemic struck, 53% of abused Indigenous women feared for their lives. Imagine the depth of their fear now as they are confronted to their homes day after day, dealing with some cases with the lack of clean water for basic hygiene. In response to our needs assessment, our affiliate, the Nunavut Inuit Women's Association, said it is extremely concerned that levels of violence have been on the increase since the country went into lockdown. Self-isolation isn't possible in overcrowded housings or shelters, and the shelters in Nunavut were already full most of the time anyway. And in the stress of the disease, and the Inuit Women's Association is extremely concerned that many who were not already suffering abuse or mental illness may be subject to attacks or may resort to self-harming or even suicide. You have probably heard the good news that so far there are no cases of COVID-19 in Nunavut. But we all know that we are on the downside of the first wave. What happens when the second wave strikes and the disease makes its way to the far north? The single Nunavut hospital based in Iqaluit, with its 35 beds and 7 ventilators serving a population of 38,000, is not equipped to deal with it. Elsewhere in Canada, there are no medical resources on some First Nations to test people who appear to be symptomatic. Support systems like community counseling and other programs have been withdrawn, and the mechanisms established to help other people cope with their special needs have disappeared. When our women try to reach out to each other, video or phone conferencing like other Canadians do, there is a lack of privacy. But of course, the poorest among them do not have the access that kind of technology. Now, our women are also resilient. In some communities, they are using donations to stock food banks and to ensure that the people who are most in need to help are getting it. But
Ms. Whitman, I'm sorry to interrupt you.
Yes.
We're having a few technical issues still with the translation, but also our 5-minute time for your presentation is up, and I'm sure you have more to say. So perhaps it'll occur later on in our discussion, but we'll leave it at there. And then someone from tech will probably give you a phone call while we're going on with our meeting, and then we'll be back again.
All right, thank you.
Okay, thank you. I'm sorry about that interruption. And now, finally, from the Women of the Métis Nation, a 5-minute intervention now with Melanie Omenijo. Melanie, please.
Good afternoon. I want to begin by thanking the Standing Committee for inviting Lefemechefotepimsoak to speak here today. The COVID-19 pandemic has shaken up all of our lives, and it is critical that we come together to discuss unique impacts it is having on Métis women and how to effectively respond to these evolving impacts. I want to identify too that I'm on the land of Treaty 6 and Treaty 8 and the Métis homeland. I'm in Alberta. One of the things that we believe as women of the Métis Nation that's really important is that we have a gendered distinctions-based lens that is absolutely needed by the federal government in response to this pandemic. And the federal government has been responding to that distinctions-based lens, which has made it so that we as Métis people are able to develop unique things towards our dealing with this pandemic. But Métis women need to be included in the decisions, conversations, and the work that is done as it relates to us. There can be nothing about us without us. I want to take a brief moment to illustrate what we are seeing in our communities in areas with limited access to medical care. Métis women risk contracting the virus when they use public transit, or what compounds this even further is that many Métis women are caregivers to many family members, creating multi-generational households, and thus risk the spread of the virus to at-risk individuals such as grandparents and infants. This is especially true for the many Métis women who are frontline essential workers and do not have the luxury of staying at home. We are seeing in Fort McMurray further outbreaks of COVID-19 because of the man camps and the working structures around the oil and gas sectors. Fort McMurray is also the second Métis community to have experienced flooding during this pandemic and added another layer of crisis on top of the one that the entire country is facing. And Fort McMurray is one of the historical Métis communities in Alberta, along with Fort Vermilion, who also experienced the flooding. We are seeing in many communities that certain software and technologies are required to participate in school programs, but because of funding limitations, the responsibility falls to the parents to provide these. Métis women and families who cannot afford are concerned that their children are going to fall behind in the school because school isn't going to be resuming before the fall, if it even resumes then. Navigating this pandemic is especially challenging for those without a stable internet connection or even a basic connection to the internet. In many of the communities, Métis women cannot protect themselves and their families because there is no soap, hand sanitizer, or toilet paper to be found. Food insecurity is also a very real issue, and even flour is unavailable throughout many communities. This is increasing the already mounting stress, anxiety, and depression that many Métis women feel. It cannot be emphasized enough how important it is that a careful approach is taken to address the occurrences of domestic violence and the situations of abuse that are increasing because of the stressors brought by this pandemic. In fact, violence and abuse are made even more possible because of increased isolation, not just at home, but in the rural communities, where isolation is more acutely felt. Abuse is now going on without regular monitoring because of reduced reporting and the lack of community support. As many child protective services are temporarily closed, better monitoring is essentially important for youth who are aging out of care during this pandemic. Our communities and families aren't in touch in the ways that they were before COVID-19 hit. When people aren't in touch, there is increased concern surrounding human trafficking and missing persons. If a Métis woman goes missing during this time, very few people will even know about it. Canada's plan has expressly called for support for Indigenous women, but rural and remote Métis women have considerably less access to shelters and sexual abuse centers. The federal government has prioritized funding supports for women, shelters, and sexual assault centers, but more must be done to ensure that rural Métis women can reach their supports during this time, especially.
That said, 5 minutes there, Ms. Omenijo.
Okay, I can close at that for now.
Okay, but we'll have lots of time through questioning to pick up any points that we've missed. And just before we go to our 6-minute question round, we had a couple of technical issues. One, Ms. Zan, are you well connected once again? Apparently you were off and on. You're good. And Madam Clerk, are we looking after Ms. Whitman's technical issues?
Yes, perhaps we could just hear a little bit from Ms. Whitman right now so we can check the audio quality again, see if anything's improved. Ms. Whitman.
Okay, can you hear me?
Yes.
Okay, so did you want me to continue saying a few more words?
Interpretation, okay. Was that good for Ms. Whitman?
Okay, we have some ideas what we can do quickly.
I'm sorry, Ms. Whitman. We're just doing a sound check, and okay. It sounds to me like the interpreters are hearing you very well. Is that right? Thumbs up, clerk. Are we better now with Ms. Whitman?
I'm not getting feedback.
No. Okay. Thank you.
Well, okay.
Thank you.
All right. We'll go on with our questioning now. We have the 6-minute round, Mr. Viersen, Mr. Pulowski, Ms. Berube, and Ms. Gazan. Mr. Viersen for 6 minutes, please.
Thank you, and to the chair, and thank you to our witnesses for being here today. I have been engaged on the human trafficking file for as long as I've been elected, and what's concerning to me is particularly in Canada, 50% of the human trafficking cases involve First Nations women. And we see right now during the COVID that many of the organizations that deal with helping the victims of human trafficking are as every organization in Canada is struggling with COVID, but we are seeing that their funding is no longer being continued going forward. And so I've just released a letter to the minister asking him to consider that. But just was wondering if, particularly NWAC, if they could respond, and have they seen any increases in the human trafficking cases going during the COVID, and if there's if the funding is continuing to help them in this endeavor. NWAC, Ms. Whitman, I think.
Ms. Whitman, could you open your microphone and answer Mr. Viersen, please?
Okay, can you hear me? Okay, thank you. What we have noticed is more the violence, the domestic abuse, from what we have done with our surveys, our assessment, as well as this online survey that we have. And it's the abuse that we found 68% is more with our women, 64 is with our elder abuse, and another 64 is with our children abuse. But it hasn't mentioned any more in regards to the human trafficking. It's more the abuse being self-isolated and social distancing, where the individual is in the same home as their abuser.
Okay, yeah, interesting. The continuing on, have you heard from any of the organizations that you would typically work with combating human trafficking? Have you heard from any of them? They've been reaching out to me. I was just wondering if you've been hearing anything from them.
For myself, no, I haven't heard any more about it, but I do know that the women are working more on the trafficking component. But with the social distancing, again, it's difficult to be able to be there to help them physically. But we do have calls that are in, and it's more in the line of the abuse and the violence of the domestic violence that, we're seeing the increase escalate far more.
Okay. And how have the organizations been dealing with that? Given the fact that people aren't able to move around, have they been moving online or anything like that?
We do have our survey that's been up. We also have an in-house where we have 4 of our elders that answer calls online, whether it be for, the women with violence, and there have also been some with suicide and what have you. So we've been working in that area. We've also put proposals in to be able to assist us so that we would be able to work down with our ground root. We do have 13 offices in different provinces, and we would mobilize the women so that they would be able to assist in whatever way they can. But the dollar is, and the funding makes it difficult for the women on the ground to be able to mobilize. And they do take calls whenever they can from their area and give them the best resources that they can that's available to the women.
Ms. Anderson-Perez, do you have any comments around that? Can't hear you.
I would say, especially from the perspective of Indigenous women and girls from remote and isolated locations, it's really critical to ensure that supports that fund organizations who deal with human trafficking and sexual exploitation remain and increase, because many times when our women and girls leave our communities and they go to urban populations, they're very vulnerable. And, aside from COVID, but, the human trafficking is still proceeding, but it's hidden much more now. So we need to really ramp up our supports and do things a little differently to ensure that we're available to protect the lives of Indigenous women and girls and Two-Spirited people as well. So it's very disheartening to hear that funding is being cut to these very important organizations to help end human trafficking and sexual exploitation.
We're right at time, Mr. Viersen. Just before we go on to Mr. Pawlowski, we continue to have some issues technically, which may be resolved in part by those who are not speaking to click off their video. And so I'll do that right now on mine, and you can see what happens. You'll either get a name or a photo, my high school graduation photo, or so in that way it really reduces the technical load and it allows for clearer translation. So if we could do that and see how it, and I'll also keep an eye on the raise hand icons in case someone wants to come in, or of course can come in anytime, and as long as we can hear you, we're okay. So I'll just start my video once again, and with those instructions, Mr. Pulowski, you have 6 minutes. Please go ahead.
Yeah, I don't know if I like this, Bob. It was bad enough to begin with. Now I'm looking at a bunch of names and hoping someone's out there. So thanks to all the witnesses for coming. In my recent lifetime, now it's changed, I'm a parliamentarian, but I used to be a doctor and worked in a number of fly-in communities, Nain, Labrador, Iqaluit, and Norway House for a few years, which isn't exactly fly-in, but it's a very long road. I see Ms. Anderson Piers shaking her head. I don't know if you're from there. I know Anderson's a really common name in Norway House. Now, I really enjoyed working in those places. But I can see if you have family problems and abusive spouse, it's particularly difficult in isolated communities, partly because a lot of people are related, partly because everyone knows everybody. So maybe you have an abusive spouse, but your spouse's cousin or brother's on the police force or in the band council. So it makes it that much more difficult. So maybe you could comment on that. But before you do, let me go on to something I really wanted to get to, which is, I think if you're in a difficult situation, in an abusive relationship in those kind of communities, it's hard enough to begin with, partly because getting out of the community can be really hard. The cost of a plane ticket is beyond a lot of people's means. I know people are, in my experience as a doctor, I've seen people so driven to despair that they've actually attempted suicide, because at least then you get a flight out of the community. So even at the best of times, getting out of these communities when you're in a difficult situation is hard. Now it's that much harder now because of COVID-19 and the attempts to kind of block off the communities for sake of the safety of people in those communities. But once you block them off, it's harder to get out as well. So maybe I could ask a bunch of the witnesses to just kind of comment on the problems faced in particular by those isolated communities under COVID-19.
Who'd like to answer? Ms. Anderson Pierce?
Sure. So it's very difficult when Indigenous women and girls and two-spirited people experience violence when they live in a remote, isolated location, particularly when it comes to providing adequate supports and resources and a shelter. In Manitoba, we only have 4 shelters in all of the First Nation communities. So that makes it more difficult, and many of the violence prevention programs are severely underfunded, as well as many of the other services, whether it be mental health or healthcare in our First Nation communities. And the remoteness and the isolation make it much more difficult to access outside supports and resources. And given in the context of COVID, it's very challenging, flight schedules, the blockades that are existing in our communities to prevent the spread of COVID. We've done a lot of work within the Manitoba Kiwatnagok as well to share a lot of information on pandemic teams about including domestic violence plans in all of the pandemic plans in our communities, and to ensure that it's addressed in their safety mechanisms that we can do to the best of our ability, given the underfunding that we receive and the lack of resources that we're able to provide as a result of severe underfunding.
Ms. O'Many, did you want to respond as well?
Yes, I did. It is a significant issue for many of the women in our communities. They're not allowed access out of their communities in most cases. In fact, there's even RCMP that keep them on curfews. So they are extremely isolated, which creates really dangerous situations for some of these people. As far as organizations receiving funding, we do believe that there were a lot of organizations that were getting reduced funding, and there isn't that many organizations that are actually on the ground delivering services at best of times. But because of COVID-19, many of the organizations that people have been relying on have actually closed their doors because they don't have the necessary resources to deliver services. So it has made it extremely challenging and somewhat dangerous for some women. We're hearing about deaths in our community, and it's very disturbing and very concerning. So we believe that there needs to be ongoing, secure, stable funding for anybody that's delivering services to Indigenous women, and that's part of what we are pushing forward on the implementation of the Missing and Murdered Indigenous Women and Girls process in the near future. So we're hoping that there is more secure, more access, and more availability. But the other little plug that I want to do is that I recognize that right now, because of the pandemic, we can only react to what's going on. But in the future, there should be a lot more work done towards prepared planning for emergency response for Indigenous women, not us reacting to what's going on, but that we are actually prepared to be able to address issues on a more stable environment all the time.
And that brings us to time. Thank you very much. And now 6 minutes for Madame Berube, s'il vous plaît.
Thank you very much, Chair. I'd like to thank the witnesses as well. Your presentations are very appreciated. I represent a very big riding, and there's a lot of Indigenous people in my riding, women, girls, men. I followed the hearings of the task force that was put together on murdered and missing Indigenous women, and often they are ignored. The colonial authorities and have infiltrated, in a sense, some of the establishment authorities. With the pandemic, it's not very clear how we can deal with that. They've increased pressures on all shelters for women, but it's almost impossible with the social distancing directives that we have. Can you tell us what's going on, particularly in Quebec, in providing these services for women?
Ms. Whitman, are you speaking? Please, there you go.
Okay, thank you. I did get part of it by the time I found the translation, but in regards, to the violence that's occurring, you're certainly correct that, with the shelters and what have you, it makes it far more difficult for our women to be able to accommodate and be able to make use of some of the services, especially with some of the shelters. They're not, some of them are not culturally related to the Indigenous women, the Métis and the Inuit. So it makes it uncomfortable, but at the same time, the shelters are accommodating to this pandemic, in which they aren't able to take as many people into the shelters in protection of the women and the children that are already in the centers. And of course, with new women coming in with children, it makes it even more distressing that some of the women's needs are not being met. Although I do understand there have been some rooms, in hotels that have been made to accommodate the women, but there's still women that are missing in these gaps that are occurring with this pandemic and the violence. It's like we're struck with two crises, the pandemic and then the violence increased. Thank you.
Merci, Madame Whitman. Aussi, je voudrais vous...
Thank you, Mrs. Whitman. What could the government do? What more could they do to support you in your struggle to provide services to these vulnerable women, particularly?
Sustainable income that's going to be able to be here. And as it was mentioned, we're reacting to this. And with the Murdered Missing Indigenous Women, the inquiry, we should be proactive, and there should be dollars that are here so that we can start having preventive methods and ways that we can meet the needs of our women. And this isn't going to happen overnight, because this goes back to the colonization and back to the conclusion that the inquiry had said with genocide. So we do need stable, and we need funding, immediate funding that will help. And we know with the pandemic, if we have a second round, it could be worse than the first, from my understanding. So we need dollars and funding that would be sustainable in order to meet the needs of our women, our children, and our gender diverse people, as well as the National Action Plan. And we're willing to be able to be inclusive and give our ideas. We did, a round table with the MMIWG. We submitted it to the government, and we had suggestions there as well, but we haven't heard anything back from the suggestions that we have given. Thank you.
Merci, Madame.
Thank you. On May 5th, Ms. Whitman, you said that you were disappointed by the 203 calls for action of the report by the Liberal government. According to you, the non-implementation of those recommendations, how much does that increase the violence against Indigenous women during this crisis?
1 minute, Ms. Whitman. Go ahead.
Okay. It makes a big difference in the line of the violence that's occurring, because we need sustainable dollars. We need to be able to work together, and we need the inclusion of the Indigenous women to be able to have a step forward, a plan that's made by the Indigenous people for the Indigenous people, that's culturally related. And without these dollars and the services that we have been given no dollars. I mean, even last year with the commemoration in 2019, we had applied for commemoration dollars, and we were refused, and we had sent in proposals. And this is disheartening when we have people who give their testimonies and open their heart to what's happened. And we have a 1,200-page inquiry report, and yet we were given that we didn't meet the criteria. And yet NWAC, the Native organization, was on the very forefront with the Sisters in Spirit, and we were on the forefront of the inquiry going ahead. And I still am baffled to why we were giving no dollars in regards to the commemoration, or dollars so that we can move forward for the betterment. And I do realize the government has given more dollars out. And he mentioned just the other day, violence against Canadian women in Montreal, and the event that just happened in my community of Mi'kma'ki. But is there a gender base regarding our Indigenous women, our children, and our gender diverse? I didn't see anything mentioned in his speech.
I'm sorry to interrupt. We're at our time there. Ms. Delaronde wanted to speak. I saw your hand go up, but perhaps it'll wait till the next question. Ms. Gazan, you are next, and you have 6 minutes. Go ahead, please.
Yes, thank you, Mr. Chair. And my questions will be directed at the coalition. I just want to first start out by commending you for your presentation. It was powerful. And, I think, certainly important for this committee. My first question is actually for you, Sandra. You spoke about the need for a 24/7 low barrier safe space in your presentation. Can you expand on the need and tell us a little bit more about what that would look like?
Thank you, Ms. Gizan. First, I'd like to say that there has been a pandemic of violence against Indigenous women and girls for as long as this country has been in Confederation. And that pandemic did not receive any license from government until the national inquiry. And the failure to act on the calls to justice for the national inquiry have provided license to individuals across this country, whether it be in domestic partnerships or in trafficking situations, to continue to devalue the lives of Indigenous women and girls. And that needs to be said. Secondly, on your question about the 24/7 low barrier safe space, what a safe space looks like is that it's not constrained by the barriers of shelters, which are generally for people in domestic relationships. A low barrier safe space would be available for people that are not in domestic situations, who are LGBTQII individuals, or people that are homeless, or people that are trafficked. Those individuals today cannot access a shelter. Also, we know that violence is not limited to Indigenous women and girls, that it's across the country, across ethnicity, and that we want to ensure the safe space in Winnipeg be inclusive of all women and women identifying individuals. Thank you.
Thank you so much, Sandra. Just another question. I mean, I know you're familiar, very familiar with the calls to justice in the National Inquiry, and I just want to speak specifically to Call to Justice 1.2V. As you know, the National Inquiries are framed around human and Indigenous rights and international conventions. How has the government fared in honoring their international obligations, such as their obligations to uphold human rights and Indigenous rights, in relation to respecting the dignity of Indigenous women, girls, 2S LGBTQIA people?
Well, I have to say that historically, since Confederation, Canada has failed to acknowledge and adhere to basic principles of human rights when it comes to Indigenous women and girls. So, hence the finding of genocide in the National Inquiry. And I think what's important to note is that any adherence by Canada to conventions, international human rights conventions, has been because Indigenous women have fought for their rights, and they have been recognized for the inclusion of those rights through the implementation of Bill C-31 and Bill S-3. And I think what's really important and critical right now, this government has committed to the implementing the UN Declaration on the Rights of Indigenous People, and have said, oh, well, we can't do it now because there's a pandemic. This is the time to be doing it. And I really call on the government and all parties to ensure that this declaration is implemented into law in Canada now.
Thank you very much, Sandra. Just moving on to you, Hilda. So, as you know, we're coming up to the 1-year anniversary of the National Inquiry, and the government, let's hope they keep their promise, has indicated that the National Action Plan would be released in June. Do you feel that families and organizations have been adequately consulted during this process? You're on mute, Hilda. Oh, you're on mute. Thank you.
Sorry, absolutely not. As someone who's on the front lines in my role as the manager of the Missing and Murdered Indigenous Women and Girls Liaison Unit for the Manitoba Kiwatnik-Okimakanek, and as someone who sits as the co-chair for the Manitoba MMIWG Coalition, and hearing from families and survivors and two-spirited people in Manitoba, everybody is wondering what is happening, and there has been little to no consultation, considering, that Minister Bennett has often referred to Manitoba as ground zero with respect to the national tragedy of missing and murdered Indigenous women and girls. So it's very disheartening. The stories that families and survivors shared with the National Inquiry, which was put into motion by many, many women fighting for years and years, to not be consulted and to not know what's happening really devalues women and girls and survivors and two-spirited people who shared their testimony. We need to ensure that those voices remain on the forefront because those are the stories of their loved ones. Those stories are sacred and they should be consulted through the entire process, including in the development of a national action plan.
Yes.
Shame on the Liberal government.
And we're at time there, Ms. Kazan. Thank you very much.
Okay, thank you very much.
And I'm sorry I missed you again, Ms. Omenijo. But
Mr. Chair?
Yes.
I would just want to point out that I was very interested to hear the answer to that last question on the national inquiry and the consultation with family members and things like that. But I would just note that when we try to stray there from COVID, we typically get shut down.
Point of order, Chair.
And so
yes, go ahead. What is your point of order?
Mr.
Viersen, we have a point of order. Mr. Viersen, we have a point of order.
This is the only meeting that's dedicated to Indigenous women, girls, and Two-Spirit. I hope that the Conservatives choose not to, once again, waste their time with their own personal agenda and go astray from what this committee has agreed to do. I did have a follow-up question. I did not have the time. I would ask him to respect the witnesses and the women here who are sharing their stories of violence and not use this as a time for a political platform. Thank you, Mr. Chair.
Thank you. We'll move on now to a 5-minute round, and we have Mr. Schmale up first. Mr. Schmale, please go ahead.
Thank you, Chair, and thank you, witnesses, for all your contributions here with us today. I asked my first question, and I could open it up to whoever wants to respond. So, as we all know, health authorities on all 3 levels of government are encouraging people to stay at home, self-isolate, keep to your immediate family, don't intermingle. I think we all agree that this is sound advice, particularly in the opening stages of this outbreak. But it didn't take, as many of you mentioned in your testimony, it didn't take into account the women and children who face domestic abuse. So in regards to this issue, there has been some recognition of this by the federal government. Some of you in your comments and your testimony said more needs to be done. So again, I open this up to whoever wants to speak first, but while money is available, can you tell the committee how exactly this money is translated into safe places for Indigenous women and children?
Would like to reply? Go ahead, Ms. Dillaron.
Okay. Thank you. I'm just busy playing with this system here. I think that money has not been made available directly to women and women-led organizations, Indigenous-led women organizations. And I think that needs to happen. It hasn't happened yet, and that needs to happen now. Thank you.
Anyone else before I...
Yes.
Okay.
Ms. Whitman, please go ahead.
I would like to also stress that with this, I had mentioned the children, the women, and the elders' abuse. And yes, the funding is so important. And we did sign an accord in 2019 in which the government, under the Crown, had said that we would be at the same tables as our Indigenous men leaders. That has not materialized. And when we have gone for funding and spoke to the ministers, we then have to go to proposal base. And then we still didn't receive any funding for proposal base. So I'm just wondering, we are very resilient women and organizations. And is there a gender-based analysis that has been done on the funding that is going out to the different organizations? Because I believe that one should be done on the Indigenous women for the funding that's going out.
Mr. Schmale, Ms. Omenijo would like to respond as well.
Okay, and then I have another question.
Yeah. Go ahead. Yeah, Ms. Omenijo.
So one of the issues that I'd like to raise is there has been funding going out to Indigenous communities, and I recognize and acknowledge that. And in some instances, I also, like within the instance of the Métis Nation, there has been a tremendous amount of work done by our Métis Nation governing people to try to address some of the issues of COVID-19, especially we've had very, like I had mentioned before, the issues of the flooding in our northern communities, the outbreak of COVID-19 in La Loche in Saskatchewan. There's been a great deal done. But you will note that none of the funding in relationship to Indigenous people has actually gone towards violence against Indigenous women or the protection and safety of women and children. So I do support my other Indigenous sisters that are on these calls to state that there has been no resources brought forward that are specific to Indigenous women in the relationship to violence, with the exception of a small amount of money that's been given to shelters on reserve. And I think that that's very short-sighted in many, many ways.
Mr. Schmill, just about a minute.
Okay. Okay. So I'll pivot off. There was someone who was speaking to answer my friend from the NDP, her question. I don't know who it was. I was trying to get my camera on. It was my fault. Whoever that was, would they like to finish their thought?
I believe Miss.
Point of order. That was Hilda. Thank you, Jamie.
Okay,
yeah,
well,
that was Hilda.
Well, we're right at time now. I'm sorry about that. We'll perhaps it'll come again.
Well, I didn't have a minute. My preamble wasn't that long, was it?
Well, I was being generous. I'm sorry about that. We'll move on, and I'm sure we'll have an opportunity to get back to it. Mr. Batiste, you have 5 minutes. Please go ahead.
Thank you. First of all, Lorraine, you didn't get a chance to finish your overall comment, and I wanted to give you, before I started my question, the opportunity to finish your statement at the front. And I'm sure that you were coming to the conclusion with some recommendations for the government. Would you be able to give us a sense of, I want to give you the time to finish that.
Thank you. I just wanted to make sure that, when we're working with funding and whatever, that we're inclusive as Indigenous women, Métis and Inuit, because we work with those women. We know where we're going, and we need to have that inclusive with the government. And we're also urging members to put pressure on the government to listen to us and keep its commitment to release the action plan. We are asking the members of this committee to pressure the government to respond to the needs of Indigenous women, girls, and gender diverse people. And with this urgency, as it has been responding to the plight of other Canadians who have also been affected by COVID-19. And we have gone through this for hundreds of years, and we need that respect, and we need to be able to work and be inclusive with the funding mechanism and a GPA. Well, Alan, thank you, Jamie. Jaime.
My second question is, I'm from a Mi'kmaq reserve, so I'm looking out there, and I'm, one of the things I'm often trying to wonder is the communication getting to the people who need it, the most vulnerable? We talk about Indigenous women on reserve, Indigenous women in the municipalities. How are we communicating with the people who are the most vulnerable sometimes about the options that they have in terms of safe places where they can go? And so would you be able to give me a sense, anyone can answer that, how that is communicated, and what is the strategy for communicating with those people who are the most vulnerable, whether it be urban or on reserve?
So go ahead.
Okay, I would like to answer that. Infrastructure for communication in many of our remote isolated communities is very difficult when we think of the internet, cellular service, and telephone lines. So it makes it extra difficult to get messaging out there. So we have to be creative in how we're able to get messaging out there. So you build community contacts on the ground that you're dialoguing with in any way that you can, because there are many times, even if there is telephone services, it's interrupted. And you also build meaningful relationships with individuals who have experienced violence, and that there's a trusting relationship there. So there's an open line. And many times once you have that established relationship, they share with other women and girls and other individuals who are experiencing violence that you're a safe place to come. And that's the same in many urban environments too. And what's really impacting right now, communicating out there, is many services are impacted by COVID-19 with the physical distancing and working remotely and stuff like that. So that's created a real challenge, and we need to really try to look at how we can deliver the service better. And, you know, as an essential worker myself, I'm still out there and I'm still connecting with communities and doing what I can to help support Indigenous women and girls and Two-Spirited people who are experiencing violence or losing a loved one through a homicide. So it's very challenging.
Ms. DeLauren, did you want to add something? I see your hand? Microphone. Mute.
Sorry. Thank you. Thank you, Mr. Chair. I also wanted to add that there is a real disparity in access to the internet, to Wi-Fi. Even as this week, we're dealing with an individual in a situation of violence who did not have access and we had to speak through a third party in order to support her. So it becomes really challenging, as Hilda noted, to meet with and support women in community. So whether the community be in remote and rural areas, it's also the case of accessibility within an urban environment that needs to be addressed and that can be addressed.
Less than a minute, Mr. Batiste.
I just want to thank the people who are on right now for their work and their important work, and I just wanted to say that I wanted to thank you. And just the last question: the women's shelters, what kind of relationship do they have? Do they have a collaborative effort where they have a national voice through NWAC or through any kind of institution or advocacy where they can directly make recommendations to government?
We're at the 5 minute. We're beyond the 5 minute mark right now, so that'll take a bit of an answer. Maybe we can come back to that. We go to Mr. Zimmer now for 5 minutes.
Thank you, Mr. Chair. I just, again, thank you for the opportunity. I have a question for Ms. Amanijo. I'm sure hoping that I said your name correctly. Is that right? Is that good? Thank you. And you brought up some really concerning problems that we had seen, actually. I'm Northern Affairs critic, so a part of my responsibility to see what PPE situation is for the territories in Northern Canada, and was very alarmed to see that the National Emergency Strategic Stockpile somewhat seemed to evaporate. And I think the problem that you brought up is that there was this assumption, I think, in many of our communities that there was this stockpile that they could rely on. So they made the request, the stockpile, the masks, the ventilators would arrive. And then even with one of our reserves just north of Fort St. John, where I live, it was left scrambling to get hand sanitizer, masks, cleaning supplies from Canadian Tire, Walmart, and all these other places, when we all were under the understanding that there was this equipment waiting for us. So, and you also brought up too, one thing that affected one of our reserves too, is that, as you mentioned, many of these community members are caregivers for their elders. So it really puts themselves at risk not having this equipment, and the elders as well. And really alarmed by that. So I just wanted you to speak to that. And I guess the next question after, I guess the response is, where do we go from here? Because we certainly don't want to see this happen again. Go ahead, Mrs. Amanijo.
Thank you. Actually, we have had a significant issue because being Métis, many of the resources that were available through Indigenous Service Canada actually went to the First Nation treaty places. And I have no idea how they were dispersed, if there actually was even that many, because we knew that there was also crisis going into the hospitals and that things were being collected for there. But it did create a significant issue in our communities. I know that many of our Métis women through the Western Canada have been busy making masks and sending them out to people, trying to prevent issues. But things like hand sanitizer, to this day, actually, I don't think people can buy a disinfectant wipe if they wanted to. So those things are causing serious issue, because in some of our communities, as you well know, the messages are mixed. When we talked about communication even earlier, there's mixed messages. Do we isolate? Don't we isolate? Are we protected? Some of the northern communities thought if they isolated and didn't leave other people into their communities, that they would be okay. And we've had massive outbreaks in some of those communities. And in fact, we've had young people dying, which is very traumatizing for us as well. So I do support and understand, but no, we need to be better prepared for anything moving forward. And we are still looking for resources, even thermometers. We can't get thermometers. And for people who are at risk and need to take their temperatures to make sure they're okay, that those resources just are not even available.
Well, maybe what I can ask again is that follow-up question to what you had said. And I think, again, we are all alarmed by, and there's been some speculation that what was given to China was our complete national emergency strategic stockpile. It was all given away, essentially. And it left us with no supplies for our own people. So that said, we're looking forward. We need to make sure that this doesn't happen again. What would you suggest that we do, especially, and we talk about, the groups is somewhat separate, the Métis that aren't affiliated to necessarily a band and don't have that same sort of governance. But we really need your solution to this, because we need to make sure it doesn't happen again. So what would be some of the solutions? And I know we only have probably a few minutes left to say what you're going to say, but can you submit that to my office or to this committee? What your ideas, because often the people that know how to fix it best are the ones that are in the trenches with the problems right now. So
that's a good suggestion, and I'll give you 1 minute for the response. Thanks, Mr. Zimmer. Melanie?
We absolutely can make some suggestions, because we do have some ideas about how we need to make sure that going forward this never repeats itself again. And we will do a written submission to you to make sure that those things are addressed. We actually have a few other things that we'd like to bring forward that we just haven't had the opportunity to do today.
Happy to help you do that and be a part of that. Thank you.
Thank you very much. And a 5-minute round once again with Miss Zan. Go ahead, please. You're on mute.
Do it. There. Sorry. It takes a while to get that mute thing off. Hello, everybody. Hello, ladies. It's really good to see all of you. Thank you so much, Walalan, from the unceded territory of the Mi'kmaq here in Truro, Nova Scotia, close to Millbrook First Nation. As you know, we've been going through a terrible time here with a recent awful shooting that bit by bit we are finding out has very much to do with somebody who had violent tendencies, domestic violence on many occasions, and was not reported. And it has led to, in the end, a massive shooting where 22 innocent people were killed. So many of the women that I'm working with and speaking with here in the province are very concerned about domestic violence. Many of us have experienced abuse ourselves, and we are well aware and well experienced, unfortunately, with domestic abuse. And we feel that for generations now, society has just not looked at this issue as an important one, because they feel that whatever happens inside the domicile, the house, is the it's the land of the king of the house, and the women are part of the chattel. And I would say that goes right across this country and to other countries as well. So
I don't want to miss a word, Lenore. Just move your mic up slightly according to the text. There you go. Keep
Is that
going.
better? Okay, I don't want to spit into it, but so I think it's time that we all work together on the issue of femicide, missing and murdered Indigenous women and others is a huge, huge problem. And to be honest, I believe that femicide is a huge problem here in Canada. And I think it's time that we all work together on coming up with a solution. I know that the Minister of the Status of Women, Mariam Monsef, is very keen to help with this, as am I, as is Carolyn Bennett as the Minister of Indigenous Services, Indigenous and Crown Relations. And anything that we can do to try and put an end to this other pandemic, as you called it, we're only too willing to listen and to try and make things better and to change the way things are done here in Canada. One thing I've noticed in my particular area in Millbrook First Nations, they are having trouble accessing funding for women who are escaping violence on reserve. They said that they can tap into the funds for off reserve quite easily, but because the council is actually closed, so the council members are not in council right now, they're having a difficulty trying to access that funding. So my question for Lorraine, for instance, is, are you finding that as well across Canada? Is that part of the problem, and how can we fix it?
Yes, thank you for that question. Yes, that is a problem that we're finding, that the resources and the services that are available on a First Nation community aren't available due to the closure of it. So the women are feeling, where do we go from here? Because of the social distancing, they're not able to. But I do know that, we have been working at our national level, trying to be able to have resiliency centers that we're working on, and we need support there for our resiliency centers for our women. And this is one of the calls of justice. So we would like to have one in every province and territory because of the importance of the vulnerable women, girls, and two-spirited. So that's another area that we need to certainly look into to be able to give the support and the services to the women.
That's a very good point. Thank you. If you'd like to take a meeting like by Zoom or something at some point, maybe next week, with myself and with the Nova Scotia Women's Native Women's Association, I'd be really happy to talk with you about that one here.
Miss Zan, Miss DeLaron had her hand up. We have a minute left. Would you allow Miss DeLaron to respond to you?
Please.
Go ahead.
Point of order, Chair.
Go ahead. What's your point of order?
Can I just confirm that we're at 5-minute times?
My 5 minutes shows 3:18, which is
Mine says 5. It's been very wonky today. Some people have been under and you're cutting them off. Some people have been way over and not being cut off. My thing says 5 minutes, and I just wanted to bring that to the attention.
Well, I'm sorry about that, but it's a very difficult to coordinate everyone looking at a digital clock, looking at the raise hands thing, and not wanting to interrupt some answers which are very important. So I'm doing the best I can, and I would appreciate your tolerance of my ineptitude. The time is up on this round, and our next round is 2.5 minutes. Miss Michaud and Miss Kakak. Miss Michaud from the block, you have 2.5 minutes.
Thank you very much. Thank you for being there. Ms. Whitman, the question is for you. We have difficulty in documenting the effects of this pandemic in this matter, but this type of crisis usually results in an increased level of violence or incidences of violence in a domestic context. We've had all sorts of, we've had a 15% increase in calls to our SOS telephone line. And Restigouche, Micmac area, 4 Indigenous women have been murdered. We know that violence is ever present there, and it's almost becoming a crisis on its own. So I'd like to know what we could do any further during this crisis, pandemic crisis. You talked about an action plan, that you have some suggestions that you'd like to make to the government. I'd like to hear your recommendations.
Very much. First of all, I know we mentioned the action plan of what we've been doing and how with the dollars that we have at our national office, we have been taking dollars from other areas in dealing with this COVID crisis that we're doing. Is we wanted to start making masks, which we have. We have purchased material for the women to be able to do the mask so that there's the protection there, that they have that ease of protection, but we haven't been given any dollars. And in answering that, we need to be included when dollars are giving out. We need to be included in the plans. And that is when there's dollars to be out, we need significant dollars to be able to be proactive, not reactive. And those are the areas we're trying to be as proactive as we can. And that's why these resiliency centers, and that's following the 7.1 to 7.9 of the calls of action. And that is to be able to give the support, the need, and the empowerment back to the women so that we will be able to work together. And there's another area of the financial component so that they will be able to increase their financial situation and standard that they're in. So we certainly need the funding and the resiliency centers to be able to be supporting our women in all the provinces and territories. And that's as well if the day programs, as well as increase in Indigenous shelters so that it meets the cultural component of the women, the girls, and the gender diverse people that we serve.
We're at time there. Thank you very much. Ms. Kakak, you have 2.5 minutes. Please go ahead.
Thank you, Chair, and thank you for all the witnesses that have given us your wonderful knowledge and experiences. As a fellow Indigenous woman, these are very difficult things to talk about, but we must talk about them. My questions are for the coalition, and just to get us started off, given that these challenges sit right at the intersection of multiple departments at the federal level, can you talk more about the difficulties that you have faced with the departments to work effectively together? And I'll ask Ms. Delarant, if you could reply to that, would be great.
Thank you. It has been difficult. We've had for many years a proposal for a 24/7, and we have not received any support for that 24/7 prior to the pandemic. So this pandemic has exacerbated the need, and it's a challenge for us because we work as volunteers to do this work on behalf of our community. I would say it's near to impossible. It has been near to impossible.
Ms. Anderson, was there anything that you would like to add to that?
Yes, I would like to add that many times with working with different government departments, it's very paternalistic and they do not respect the Indigenous knowledge that we carry as Indigenous women and girls and two-spirited people, and do not allow us to lead many projects. It's very restrictive, and I think it's really time for governments to recognize that we have the answers within us as Indigenous women and girls and two-spirited community, and given our cultural practices and our knowledge that we know what we need and how to go about, creating that change. But in saying that, we also need those adequate resources that are long-term and sustainable. The lives of Indigenous women and girls should not be dependent upon project funding. That's unrealistic and is killing our women and girls and two-spirited people.
I believe.
Thank you both so much, Mr. Chair. If I have the time, according to myself, I have about 30 seconds. I'd like to give a notice on a future date. I will move the following motion, if that's okay, if I read the motion.
Read the motion.
Thank you, Chair. That given the recent resignation of Kathy Bennett from the federal government's COVID-19 Supply Council due to a conflict of interest, since she is the chair of the board of Dynamic Air Shelters, a company that currently has a contract with Indigenous Services Canada, the continued lack of transparency for predominantly Indigenous communities with respect to the delivery of supplies and resources. Oops, sorry, I clicked something.
I'm sorry, you're well over the time, Ms. Kakak, and
okay.
By a
that will be sent out to the committee. Thank you, Chair.
Thank you. We have 5-minute rounds now, and Mr. Dalton, Mr. Van Couverden, Mr. Viersen, and Ms. Demoff. And Mr. Dalton, you are up for 5 minutes. Go ahead, please.
Okay, well, thank you very much. I'm pleased to be here. Thank you to all the witnesses that are sharing their knowledge here today, and I'm substituting for Gary Vidal, and glad to be able to be joining the committee today. I'm the Member of Parliament for Pitt Meadows, Maple Ridge in the Greater Vancouver area, and traditional territories of Katzie and Kwantlen First Nations. I am Métis and a member of the Métis Nation BC and locally the Golden Ears Métis Society. And so in British Columbia, as we find throughout Canada, in BC in particular, there's about 75% of Indigenous peoples live off reserve, and particularly in the urban centers. In my riding, surprisingly, the Indigenous people are the largest, if you want to say it, group of people, more than Chinese, Indo-Canadians, or anything like that. So it's really, for a suburban riding, it's very, very surprising. It's about 4,000, of which about 2/3 are Métis. I was this week talking with the chief of the Katzie, Chief Grace Cunningham of the Katzie First Nation, and she expressed the concern. Actually, earlier, I should say, she was expressing the concern that the funding and supports for her people are not off reserve. For example, they might reside just a few blocks away, but that the funding and supports are not there, and they feel that they're being left behind. So I'm just wondering, perhaps Lorraine, if you want to make a few comments regarding supports for urban Indigenous peoples, particularly women.
Thank you. Yes, I do believe that the dollars base, for our women, there has to be a gender-based analysis when it comes to dollars, because we're seeing funds and funding that's being given, but it's to just one source, but it doesn't give the definite area where the funding's going. And as being Indigenous, the women, our children, our girls, and our gender base, we need to be able to make sure that each and every one of them are taken care of and not forgotten. And as it was mentioned earlier, the dollars that go out are just, we're always running through hoops and to get proposals in, and then not to be able to hear from the proposals that have been given. I know when anything comes on my desk, I will let them know that, yes, I've received it. But it's not that way. When we put in proposals, we don't hear from them, or we're not given the dollars. But yet, when we do receive what funding we do, when our report is due, they're on the line asking us for the report, or our funding will be disrupted. And that adds that extra stress on the added stress that we have as well, working with our women and our girls, Indigenous, are gender diverse. So it makes it difficult that the funding is not there for us women, and that we need to be inclusive in order to give our women what they need. And we need to go back to the matriarch society that we once were and know that we are important in the whole scope of this.
That's great, Lorraine. Thank you very much. There are about 600,000 Métis in in Canada, of which about 75,000 are in British Columbia. And I know that there was recently an announcement of $305 million to be for supports in this time of COVID for Indigenous people, of which only $15 million were for off-reserve Indigenous people and Métis.
1 minute, Mr. Dalton. Go
and
ahead.
I'm just wondering if perhaps Melanie, you can share if how you feel about this, if it's an appropriate distribution allocation of the funding, or just maybe make a few comments on that.
Thank you for that opportunity. There has been very little resources that have been able to go to urban Indigenous issues and in urban Métis people. And I recognize that there has not been the necessary supports to even deal. I live in Edmonton. I do appreciate the British Columbia issues as well. But we're in one of the largest Indigenous urban centers in Edmonton, and there's been very little, if any, funding at all. I know that when the federal government came to us as a national Indigenous women's organization, we did want them, and we do encourage and support the money for COVID-19 to go to grassroots community organizations. So we were pushing and hoping that there was going to be more of that, so that people delivering services on the ground would have those resources available to them.
Thanks for your answer. That brings us to time. I'm sorry, Ms. Delarond, I didn't have an opportunity to respond to your hand. We go to Mr. Vancouverton now for 5 minutes. Please go ahead.
Thank you very much, Mr. Chair, and it's a privilege to hear your stories. I wanted to thank the 4 strong Indigenous women and witnesses today for your contributions. I want to acknowledge the intersectionalities of the impact, and also say that I know that I speak for everybody on this committee when I say that we're eager to help, and we want to try to make things better. And your feedback and perspective and insight, and the feedback and perspective from the 2 women who serve on this community, Ms. Kazan and Ms. Kakak, are super valuable in that pursuit. The purpose of these forums is to provide feedback and criticism and recommendations, and I thank you for that so far. I don't want to talk for the duration of my 5 minutes. I want to hear from you, and if I could just ask for some feedback on youth mental health. I'm the Parliamentary Secretary for Youth, and I would love to hear from you on what we can be doing better to serve this very vulnerable section of the population in Canada, because youth mental health is something that comes up on every one of my youth calls. So thank you so much for your feedback today, and I thank you in advance for your answers.
Would you like to respond?
I would.
Go ahead.
Okay, so I think youth mental health is really critical, especially when we look at Indigenous girls and our youth who are living in remote, isolated communities, as well as other First Nation communities. There is a mental health crisis in many of our communities, even prior to COVID-19, with the high rates of youth suicide. And in order to address that, we need to ensure that adequate supports and resources are put into place that are culturally based, because Western programs do not address the needs of Indigenous people, and we must start to recognize that. Again, I reiterate that the answers rest within the communities. We need to ensure that there's access to culture, to language, to education that is based in traditional knowledge. We need all these really important things, and poverty plays a huge part in the challenges related to mental health and youth. So we must address poverty in our communities.
Ms. Omenijo, did you want to respond?
Yes, thank you. And actually, thank you, Hilda, for that. I absolutely support what you said. And it's really important when we're dealing with our youth that a lot of the communication that's even going out there for them to be able to resource or find supports has not been youth friendly. So many people don't understand the messages and haven't been getting the communication to youth that's necessary to help protect them through COVID-19, which is very disturbing and concerning because some of them are at extreme risk.
Ms. Delarond, you have your hand up.
Hi. Yes, thank you. There was a couple of things I wanted to note, particularly in the time of COVID that additional support, in addition to what my colleagues have said, additional support to assist children and youth with their schoolwork, which means access to infrastructure and to tutoring, to also support the parents as they support the children as they learn from home, but to also focus from birth on, to eliminate the birth alerts, to support families in positive ways that integrates culture and love and learning into their daily practice, rather than trying to fix things at the end. Work on preventative processes is what I would recommend. Thank you.
1 minute left, Mr. Van Couverden.
Apologies. I think, Ms. Whitman, did we have a chance to hear from you on youth?
You need your...
I think it's very important that we do look at the youth, especially where the violence is. The youth and the children are still in the home where the violence is existing, and we need to really take charge and be able to implement and be proactive so that we can assist our youth, because they are our future, and we need they do need proper tools to be able to deal with what we're going through. And again, I don't think the education or the systems out there to be able to support our youth at this time, and we need a lot of work to be done in that area.
Thank you. That brings us right to time. Thank you very much. Mr. Viersen, for 5 minutes. Go ahead, please. Mr. Viersen, I have you on my schedule. I'm not sure if there was a change, but Mr. Viersen, are you there for 5 minutes? Mr. Dalton, would you like to step in for Mr. Viersen? Mr. Schmale, would you like to step in for Mr. Viersen? Go ahead, Mr. Dalton.
Just a question here regarding, apologies, that might be better. Okay. Regarding the accessibilities to PPEs and masks. I know there was some comments a little bit earlier, but if we can just, I'll open it up to whoever would like to address that. But I know that these are getting to the hospitals and other locations, but as we open up our our country to from COVID economically in a variety of ways, what needs are there significant gaps? I know that one of you mentioned about Métis women, I believe, making masks and all that, but can you maybe different ones you elaborate as far as how we're doing, or how prepared are we? Are we ready to go forward in these practical ways? What can the government do on this? So I'll just maybe different ones you might want to comment on that. Thank you.
Ms. Whitman, I see you have your hand up. Go ahead, please.
We have, on our NWAC, we have put dollars out of our own funds to be able to do masks, but those aren't the medical masks. But we need to give our women, our elders, that piece that at least they're being comforted by the mask, whether they go outside as well. We have younger mothers, single moms that may have 3 or 4 children. And in order for them to go out, they need a mask because they're afraid of bringing the virus home to their children. And it's not economic to take the children with them because they can't go in shopping as well. So there is a seriousness. And I don't think we're equipped if we have a second round or a second wave of this virus as what is being expected. And I think there should be dollars that would be available so that the women at home and the moms and the elders and the vulnerable, as well as the ones with addictions, we need to be able to take care of all of our people. And I don't think we're equipped at this time.
Ms. DeLaron, you had your hand up. Oh, you need your mic. Unmute.
Yeah, so sorry. I just want to note that there is no support for Indigenous women in any urban area. And I would say probably in remote areas, but Hilda can speak to that. So there's no PPE when we are, and there's no distribution process. And so if we're talking about reopening out, then we know that Indigenous women and their families will maintain that vulnerability and, will be at the highest risk for contracting the virus. So, no, we're not prepared. Indigenous women need to be protected, and they need those resources in order to provide that protection. Thank you.
Another minute or so left.
So we've talked a bit about on the urban side. What about in the rural communities? Even maybe up north. Do you have any comments about that? For support, would you say it's the same story in the rural side and the urban in the northern communities as it is in the urban as far as the needs, or is it even more pronounced?
Ms. Anderson-Piers, go ahead.
Yes, I would say that it's even more pronounced because when we look at urban areas, there's access to, different stores that on occasion will have PPE equipment. But when we look at remote isolated locations, it's difficult to even adequately resource essential services. But when we look at providing community members with masks and PPE equipment, if borders and stuff are starting to open up, there's a big risk there. And we really need to, lobby the federal government to ensure that PPE equipment is made available and is readily accessible to all Indigenous people, regardless of where they live, because it will protect their lives.
That brings us to time on that. Thank you very much. And Ms. Demoff, please go ahead for 5 minutes.
Thank you, Chair. I want to start by acknowledging that I'm on the traditional territory of the Mississauga of the Credit First Nation. I want to thank all of you ladies for joining us today. I wish we had a lot more time, and I wish I had more time. The ladies from Manitoba, Minister Van Daal, office has reached out to you. He'd very much like to speak to you both with regard to your concerns. Ms. Gazan brought them up yesterday in the House, so his office has reached out to you. So please watch for that. And I also want to clarify, too, that PPE off reserve is actually distributed by the provincial government. And I know that's frustrating, but when it's off reserve, it's done by the province. And we try to support them by accessing the material for them to distribute. But the actual distribution in urban settings and off reserve is provincial. What I want to talk about, and it kind of ties into that with the different jurisdictions, we've provided $55 billion over 10 years for a national housing strategy to try and end homelessness. And that flows through the province and then to the municipality. We know that there's a desire to end homelessness in local areas, but I was speaking to Jesse Thistle on the weekend, and he said people want to end homelessness, but they don't want to end Indigenous homelessness. And I would argue that when you talk about then Indigenous women who are homeless, it's even worse. So we've done an okay job of providing funding to violence against women shelters, but not Indigenous shelters that cater to homeless Indigenous women who may have an addiction or other things that means they can't access them. So I wonder if I would love to hear from all of you, how can we better support and get more acceptance of the need to support Indigenous women who are homeless? Because they either end up murdered, missing, or in prison.
I can start. I think we need to really look at implementing the Call for Justice 4.5, guaranteed annual livable income immediately, because, and we also need to look at colonization and the impacts of colonization. Many of those women are homeless as a result of the impacts of colonization. And we need to start from a very young age, supporting families and providing all the resources that are needed before women and girls end up in vulnerable situations and are homeless. If we can do that as a country, we will be doing something very powerful. We can't look at why are they on the streets now? Why are they homeless? And they're very vulnerable and they're very susceptible to all forms of violence. So we need to look at how can we do better as a country and not try to address something after it becomes a really high risk situation to Indigenous women and girls. We need to start from a very young age and provide adequate resources, because it really breaks my heart that we're always looking at, trying to save our women and girls. Why can we not give them environments, that they can thrive in and not worry about where their next meal is coming from? Where are they going to sleep? We need to do better as a country.
Can I the problem is that we have there's two parts of it. One is preventing women from getting there in the first place. But if they don't have access to culturally appropriate places to go to heal, it's very difficult for them to get out of that cycle of poverty and homelessness.
And that's the thing too. So I'll just add on to that. Many times, as Indigenous women who are leaders in our communities, when we want to develop our own programs, because we know in our hearts, many of us have had a lot of similar experience as our sisters who are homeless and have found ways to heal. When we try to share those ideas and we try to access long-term sustainable funding, we're continuously denied, to be able to help our sisters who are struggling and to provide culturally based programs that are Indigenous led. I think it's time that the government really hears our voices and takes what we're saying and puts it into action.
I only have 30 seconds left if somebody wants to jump in.
Ms. Omeniho had your hand up.
Hello. One of the issues that I'd like to raise at this point is that many of the women that we find that struggle with the issue of homelessness generally end up also involved and engaged in the child welfare system because they can't afford to maintain homes for their kids, and in living in urban environments where they very often run to from rural communities, they can't afford the kinds of rents and things that are available. There is not enough housing support for Indigenous women within many, many areas and centers.
Thank you. We're at 5 minutes there. Thank you very much. We'll go to a 2.5 minute round now with Ms. Berube.
Merci, Monsieur le Président.
Thank you, Mr. Chairman. So my question is for Ms. Omeniho. What should the federal government do to ensure the safety of women and also girls and also Indigenous family and LGBTQA during the pandemic? What should they do?
That they have to work with the organizations that are at the grassroots level, and I think they need to fund them. I think there's been a lot of resource given to other counterparts in doing many things, and we hear about that all the time, whether it's business loans or whether it's various other institutions that wage subsidies, but there has been no work done towards ensuring that people at service delivery processes can continue to deliver services to our community, and they're not being funded and supported. I really support the fact that has to happen, is that money needs to go to these organizations that are at the grassroots level to be able to deliver services to the people that are there.
Ms. DeLaron, have about a minute. Go if you'd like to carry on.
Oui, et selon vous, les ressources.
Well, according to you, the financial resources which we have right now or that have been announced by the federal government, are they sufficient, these financial resources, to fulfill the needs of women, girls, LGBTQ+, First Nation, Métis, Inuit in terms of the shelters? Is that enough?
Thank you for that question. The resources that have been designated for COVID-19 and for shelters and I'd have to say shelters, not safe spaces, is not reaching the community, the Indigenous women's community. And I think that in order for change to occur, that these processes must be Indigenous led. And even now, the amount of money received between federal or provincial shelters, there's disparity in that amount of money, and they are always at capacity, and they need renovations, etc.
And that brings us to our time. Thanks, Ms. Delrond. And Ms. Gazan for 2.5 minutes. Please go ahead. Mute.
Mr. Chair, my last question is for the coalition again, specifically Hilda. You mentioned that there are only 46 women's shelters in the country and only 4 in Manitoba. And clearly this is a crisis. I know I live in Manitoba. Where are the gaps and what needs to happen immediately to protect Indigenous women, girls, and 2S LGBTQIA people?
The gaps exist in infrastructure to provide these safe spaces as well as capacity development, especially when we look at our First Nation communities, even in urban environments, many of the same challenges we experience in our communities exist in urban environments too, because Indigenous women and girls and two-spirited and gender diverse people are often forgotten in program development or accessing those resources. And ending poverty, I always say this because we need to end poverty. Many of our women and girls end up in these vulnerable situations because of poverty. And I want to reiterate, that the federal government needs to immediately implement the Call for Justice 4.5, the Guaranteed Annual Livable Income. Because if you can find safe spaces to live, and if you're able to thrive and you're able to grow and you're able to access different resources that are readily available or currently being developed, that is so critical. If we can't have that, and if we can't develop from an Indigenous lens, and that we're at the table, that we're making those decisions, we're developing those plans, you're going to continue to see extreme levels of violence because we cannot, accept paternalistic approaches anymore. We have our own ways and they need to be respected to protect our women and girls and two-spirited people.
Thank you very much for that. Am I at time, Chair?
30 seconds.
30 seconds. Did anybody want to add to that? Mrs. Whitman, would you like to add to that?
I agree with what was just said, and truly we do have to look at it from the matriarch lens. We've gone through the paternal so much that it's caused so much problem within, and that's one of the areas that we really have to look at, and that was mentioned at the end of the National Inquiry report is the finding. And of course it did mention genocide as well, and I do have to go into that. Because that's an important component. And I think Canada, we can be a shining light if we work together with the women so that we're able to nip it in the butt now and start moving forward in a positive way.
Thank you. Thanks, Ms. Whitman. Committee, we have not enough time to do the next 5-minute round. We could get one more question in. I have Mr. Schmale as a 5-minute question round. So we'll do that. We'll have Mr. Schmale and then we'll wrap up the session. Mr. Schmale, I'm going to give you 5 minutes starting now.
Thank you. Actually, I think it's Mr. Zimmer, believe it or not.
Well, okay. I didn't have that on the list, but go ahead.
All right. Thank you once again, Chair. And question again to Mrs. Amanijo. And the question is we talked about, the PPE situation, and I guess with regard to Métis and being that unique group that's sometimes difficult, place to get resources from. And I guess I almost feel like asking Ms. Damoff a question. She said that the PPE is the responsibility of the provincial government off reserve, but on reserve is then the responsibility of the federal government. And we haven't seen much PPE get to those reserves. So I would just ask the question, that also needs to be part of the plan to fix, because again, we saw some of our local reserves scrambling to find their own PPE during the crisis. But Mrs. Amanijo, what do you see that needs to be done right now? We've seen some of the programs, the CERB and different other things, just to help with the everyday lives of Métis women and girls. What could be done right now? Do you find that the programs currently offered are kind of fitting the bill, or is there some gaps there as well? We've heard gaps just in my citizens and my constituents, my local riding, but what do you see are some specific gaps, especially with regard to Métis women and girls?
Thank you. There are considerable gaps to Métis women and girls. There's food security issues that are going on that are still affecting. I mean, maybe in an average world, if everybody had access to money and resources, they can try to access those kinds of things. People can say what they want. Groceries are going up. I mean, I feel like I'm a more privileged person than some. And I'm able to buy my own groceries. But if you can't find them in the store, or if they hike the prices so high that you can't afford them, what are people that don't have that kind of income doing to be able to supplement? And going forward into this new transition of where they're trying to open things up, we do still need PPE. I know there's been some small amounts leaking out from different places, but we need to be able to educate our people the importance of protecting themselves as they open up these things, because I do agree, Lorraine mentioned it earlier, on the second round, things are going to be a lot worse if we don't have people able to protect and defend themselves against this virus.
Now, Miss Amenejo, would you say the distribution network is there? Like where, if, again, this is sort of the broader answer. I hope you're going to write the committee as soon as you can, the broader answer to this. But that distribution network, where should that PPE be given, again, to specifically get that equipment to Métis peoples? Where should that be, made sure that, so it essentially gets into your hands and the people that need its hands and the caregivers that you mentioned, the elders. Where should that be best placed?
I'm going to be really honest. The last place should be the provinces, because the provinces very, very often don't work with, they tend to work with the treaty organizations, even though they're supported federally by the Indigenous Services Canada. But I think that, number one, I think there can be a coordinated effort amongst our Métis communities and our Métis organizations. There's lots of them. And I do know that they're trying really hard to do food hampers, grocery cards, things that are tangible for people to make a difference. And I think that them having access to those resources would make it far easier to get that out to our communities rather than it go through a large bureaucratic process.
Yeah, I think that's what we're working. Yeah, and thank you again for that. I think that's the answer I was looking for, is because we can have an answer that looks great on paper, but if that mask, that N95 mask, isn't making it to that 23-year-old nurse that's caring for an elder, then it all doesn't matter, right? We need to make sure that it gets to the people in a timely fashion. So again, we look forward to your response. Again, reach out to my office or the chairs so we all get this information. We can get it done. We know it needs to happen. So again, thank you for your time today, Mrs. Amenejo.
Well, that brings us just about to time.
Point of order, Mr. Chair.
What's your point of order?
Mr. Zimmer implied that Indigenous Services Canada was not getting PPE onto reserve, and that's simply not true. And while I wish that the federal government could send PPE down to women like Melanie, we just can't. There's a province in the way, and we have a constitution.
Okay, that's a point of debate, and I'm going to interrupt on that at that point.
Okay. I would debate her on that every day because
I'm sure you would.
In the north here are simply not getting it.
I want to thank first of all, our committee, because these are difficult, profound issues. And I thought that we had very useful questions and comments from our committee for the most part. And of course, our witnesses from the Manitoba Coalition, Hilda Anderson-Piers and Sandra De La Ronde, from the Native Women's Association of Canada. We finally got you on and connected, and it worked out very well, Ms. Whitman. Thank you so much. And from the women of the Métis Nation, Les Femmes Mishif Otepemisi Wak. Did I get that close? I practiced a bit before. Anyway, you know who I mean, Melanie. Thank you all. We're so lucky to have people like you that are involved in trying to solve these problems, only exacerbated by the current pandemic. And so once again, thanks to everyone. Our next meeting will be next Friday, And until that time, I'm going to say thank you for this committee meeting, and I call this meeting adjourned.